that, if we don't, get this shot or take this medication or do these things, then the disease is going to get you. But in all actuality, how the body actually performs is in a state of dis-ease. So if your body is at 100% working, rock and rolling, there's not anything in the world that's going to attack you that's going to bring that body down. But once your body enters the state of dis-ease, now these things that have been dormant in your body will now show its face and bring your body to be a suppression. So then your body has to create fevers to burn off pathogens, and it has to sweat to get rid of these toxins, and your body's constantly trying to adapt. So once you kind of have this mindset of dis-ease versus disease, you can kind of learn how the body works and learn how to adapt in certain ways like that. So the one thing I want to talk about, I want to take your faith out of doctors completely. And that's kind of weird to say from a doctor.
Hey, can I ask you a quick question before you go into that?
Yes, sir.
So when you say that there's a bunch of things that are laying dormant in us, so can you expand on that just a little bit?
Yes. So from the time that we're babies, there are tons of things that actually enter your body, and your body identifies these, and it either will invade your body to the sense that you will create sickness because it doesn't recognize it. But once it will recognize it and you go through the disease process, that identity of the virus or bacteria or whatever it is will actually store in your body. So for instance, let's say you get the flu, right? That is the first time it's entered your body, and your body will then go through its process to identify it. And it'll either say, okay, we got this under control. Here's the proper things we need to do to address it. Or it'll say, we don't know what this is. Let's secrete everything to go into defense mode. And that's when you enter that dis-ease mode. But once you contract that virus or that bacteria, whatever it is, whatever that foreign invader is, your body will actually store it with things called memory cells. So then anytime that comes back, that same strain, you're immune to it basically. So this is why we've never seen this. It's called, there's a funny word for COVID-19 they've been using that says, hey, we've never seen it before. I forget the terminology for it. Novel virus. That means we've never seen it before. So nobody is immune to it. But there are several strains of coronavirus that we've already been in contact with, you and I. I'm certain of it. We've come across it. And just like the flu, every time you get the flu, that's a different strain of the flu, which is why they're constantly trying to produce these flu shots. And when they give you a flu shot, what's the first thing that happens when you get the flu shot is you get sick with the flu. So it kind of defeats the purpose of the flu shot, in my opinion, of course. That's a whole nother 3-hour topic. But
we'll schedule that one after this.
Yeah, we're gonna go right back into that one right after this. So I wanted to talk to you about how you guys are really your own superhero. Your body is the most incredible thing on this earth, and for some reason we've been trained to believe that we know better than the maker of the body. So how many people, and I don't know if you can raise your hand on this thing or not, but how many people, whenever you've been trained that whenever you get sick, you need to go get this injection or this shot or take this medication, and then I'll see everyone raise their hand. But I want you to understand that life is the healing force. No medication, no pill, no anything is going to heal you. There is no cure for anything. Life does the healing. And if you don't believe me, go get a steak from Randall's over here or the butcher shop, take it home and inject it with whatever you want, wrap it whatever you want, force any kind of medication into it. It's not going to get better. It's not going to come alive, is it? And you're going to say, well, that's ridiculous. The steak's dead. But that's the point, is that life is the healing force, not doctors or medication. All the scientists in the world couldn't heal a blade of grass because life is the thing that does that. So I want you to put the faith back into yourself to build your immune system, and that's going to be your best defense throughout this whole thing. And not just COVID, but throughout all walks of life. And so number one, it starts with a good diet. If you are putting garbage in, you're going to get garbage out. I have a quote in my clinic on the TV here. It says, you can't get $1 million body living on the dollar menu. And I always chuckle at that just because it's a funny statement, but there's so much truth to it that many people will go, well, how much is that? Before they think, what's the nutritional value or what's this going to do to me? It's the truth is most people take better care of their car than they do their body. They know that, okay, I need to get the oil changed, I need to get the tires rotated, I need to get the alignment, I got to have this filter changed. And these cars, they only last 1,000 or 100,000 miles, 200,000 before they kind of start physically breaking down. You're stuck with this body for the rest of your life. And most people just take advantage of how well this body can adapt without really putting the proper, the maintenance that really goes into the body. I mean, you pay for your health at some point. Health is wealth. So what else do we want to talk about here? We got nutrition is probably the big thing. And then the one thing you can really control from home, and this is really, you got to dig deep on this one, is your stress levels. Stress plays a tremendous role in immune function. So cortisol comes from your adrenal glands, which sit right on top of your kidneys. So the first thing that you feel whenever there's sickness coming on is you'll feel this achiness kind of in the mid-back. It's called flank pain, but really kind of where your kidneys are located in the back. Let's see if I can show you guys. Kind of in this area right here. On both sides, you'll feel kind of achy or dull in that area. And that is your kidneys talking to you. There's these little glands that sit on top of your kidneys called your adrenal glands. And your adrenal glands are responsible for cortisol production, which is a stress hormone. So anytime you're stressed, whether you're thinking, oh my gosh, I'm so stressed about this, or there's any abrupt change in your life, such as quarantine, that will actually create a hyper secretion of cortisol. And so you'll actually secrete so much cortisol, your body goes into almost shutdown mode, where it'll pull certain bones out in the back that control the nerve function to that to stop the production of cortisol. And I can see it in people's face when they come in here. The crazy thing about cortisol is it's actually a pheromone. And what a pheromone is, it's something you can smell. So like glucose changes in bodies, you actually emit this fruity smell, and dogs can pick up on that smell, and they're trained their dogs are trained as service dogs to be able to detect when a diabetic attack is coming on. So cortisol is actually a pheromone. So how many times have you been in a room and someone's walked in and you're like, I feel the stress on that person, or that person's just uneasy, there's something wrong about that person, or I just get weird vibes, or someone even, they walk in the room, don't say a thing, but you can just tell something's wrong. Well, that is actually you smelling that cortisol on a biochemical level. Not that you can identify, oh, that's a fruity smell, but that you're actually sensing that smell in that person. So whenever your stress levels are high, just remember that you're putting off that smell, and someone's usually being able to identify that. So if there's a big meeting or a big financial deal going on, you need to get your mind right beforehand. I don't know if a lot of people knew about the pheromone thing, but when I learned that really opened a lot of doors for me. Like, oh my gosh, no, you need it's a whole body presentation thing that's going on. So the immune system is actually composed of the thymus gland that sits right here whenever we're babies. And as we become kind of like teenagers-ish is when it kind of actually decays, atrophies, and dies off. So when we're babies, this thymus gland is in charge of producing things called T cells. And so I can go into a really long thing of this endocrinology of how we're built. A lot of it's just kind of but the big thing that you want to get to in terms of how the immune system functions is it really comes down to how the nervous system functions. So there's a lot of organs that are responsible for your immune system: your spleen, the lymphatic system, antibodies, eosinophils, antigens, lymphocytes, macrophages, bone marrow, white blood cells. All these things make up the immune system. So we can talk about that for hours and getting down to the nitty gritty, but none of those things can communicate to each other at 100% unless the nervous system is working at 100%. So let's talk about sympathetic versus parasympathetic nervous system. Has anyone heard of those terms before?
Yep.
Yes, no?
Hey, real quick, I forgot to introduce you.
Go ahead.
Can you just tell everybody who you are, what you do, and why you have such a wealth of knowledge behind this, and then continue into sympathetic. Sorry.
I'm just some random guy in the street. I was talking to Deepak, and he said, you know what, I'm actually Deepak's neighbor at OsteoStrong. I'm Dr. Jimmy Allgood. I am a neurology-based pediatric chiropractor. And that is not a term you hear very often. Most people, when they relate chiropractor, they think car accident, neck pain, back pain. But really, chiropractic is the function of nerves and not the function of bones. So going through school, I glued to absolutely everything I could about the body and how it functions, how it works. I was just really, really fascinated. And then so in times like this, it's really pertinent that I got to take this wealth of knowledge that I've retained and just spread it to everybody. And so my big focus in my clinic is getting the nervous system to function optimally. The nervous system is the key function to everything. It's called the Master Control Center by the Merck Manual in Medicine. It's the master control center for everything. Even me talking to you right now, there is an effect it's having on the nervous system. There's a nerve that's going to your ear and the tympanic membrane, going to your brain. You can tell them, hey, this is what these words mean. It's English. The nervous system controls everything. And whether or not you retain, go ahead.
Let me give you a little plug. So, folks always ask me, hey, do you believe in chiropractic? And, who's this guy, Jimmy next door? So to just give validation to it, almost my entire family goes and sees Dr. Jimmy. My coaches also go see Dr. Jimmy. I go and see Dr. Jimmy. So is the work that he does valid? 100%. So I just wanted to throw that out there. And he's been doing a ton of great work in helping a lot of us get through a lot of pain. So, he's awesome. So if you've ever thought, most people have this association when they say the word chiropractor, what do you think they think of?
Chiropractor?
Yeah.
Most people think car accident.
Yeah, exactly.
They think I don't need a chiropractor, but I've never been to a chiropractor. I don't need a chiropractor. I get that every day.
Right. So what do you want them to think when somebody says chiropractor? What would be your wish to get them to associate?
Man, that is a fantastic question. My big driving force in life is to change the definition of chiropractic from car accident, back pain, neck pain. Really, chiropractic has nothing to do with pain at all. Even though 90% of my patients come to me for pain, I'm able to get them better by focusing on the nervous system. So I'll take an x-ray of the spine and I'll look at the spine because it's the telltale sign to tell me how that nervous system's doing. It's the key to the nervous system is the spine.
Yep.
And if I see anything that's misaligned, I'll focus on the nerves from that spine to that area. And I'll test, okay, the range of motion here is not bad. Or this organ's not working correctly based on your history, things you're telling me, or I'll test these certain muscles that aren't working correctly. And we can narrow it down and say, okay, this nerve is functioning 7 out of 10, 3 out of 10, or this is what to expect long-term if we don't get this thing corrected. So it really what I want people to associate chiropractic is when you think of dentistry, you think, oh man, I need to go to the dentist because if I don't go to the dentist, then this happens, this will happen. It eventually leads to this, which is pretty serious. The same thing is true with the chiropractor. If you don't go and have routine spinal maintenance or spinal hygiene performed, then eventually you're going to run into pain at some point. If you don't take care of that pain, your body's going to adapt to the pain and it's going to create some degenerative process. And eventually you're on the road for surgery. And the surgery success rate when you're talking about the spine is less than 50%. I mean, it's really, really bad odds. And so many of these things can be prevented just from taking care of the spine. These teeth, when you go to the dentist, these teeth, you're so focused on how your smile looks and the hygiene of it, but these teeth can be replaced. And not that you want to, but we don't have that option with the spine. You're stuck with these things for 90 plus years if you're living healthy, 50 if you're not.
I agree with what you're saying. The whole thing of most of the folks that come to see us originally come to us because of some type of pain, right? Yeah. And I have this saying, I don't know where I got it from, but it's when you're early in your career, you spend your health to get wealth. And then at some point, there's this tipping point to where your health starts to fade away. And now you start to spend wealth to get health. So I would love to see this transition in society to where instead of being reactive and coming to see both of us because of pain, that they start taking care of it ahead of time.
Yeah, absolutely. I would like to see a proactive versus reactive healthcare mindset.
Yeah, that would be amazing.
And I'll be honest, dentists have done a fantastic job at educating the public about that because they, if you don't brush your teeth, you don't get your teeth clean, this happens. But
Yep.
that's not the case for really anything outside of healthcare. Chiropractors do a horrible job educating the public.
Well, not a lot of people like their dentist though, so you don't want that reputation either.
That's true.
All right, so you were saying about the parasympathetic and sympathetic, and I know I want to be respectful of your time. I know we got about 10 more minutes, so if you want to get into some things that they can do at home.
Yes, so I'm gonna dive deep on some things I really want you guys to know, and if we go over, that's okay. Your knowledge is more important than my time right now. So there's two different types of nervous systems in the body. There is the sympathetic nervous system and the parasympathetic nervous system. So sympathetic has the term fight or flight. So for instance, how the body was designed, if you were getting chased by a tiger, and when I say tiger, I think Tiger King, guys, I'm sorry. But whenever you're getting chased by a tiger, you have this fight or flight mechanism where your blood pressure goes up. It takes all the blood from your core, puts it to your extremities, your pupils dilate, and your digestion stops. So that you can either fight that tiger or you can run and get away. So that's the way the body's designed in sympathetic mode. So parasympathetic mode is the exact opposite. It's when you eat a big giant meal, you're feeling fat and happy. It's called rest and digest. It takes all the blood from the extremities, puts it into the core so you can relax. Your pupils constrict. You're getting nice and lazy. So wellness and healing will take place only in a parasympathetic state. You cannot be stressed and heal at the same time. So this is why we run into a lot of autoimmune disease, a lot of neurodegenerative diseases, because in America, we live 99% in a stressful state, no matter what. This is why true healing happens in a relaxing state. There's lots of stories of people healing these crazy cancers just going to a resort in Mexico and eating well. Yeah, I mean, that's the parasympathetic nervous system.
And that's what's happening when we sleep as well, right?
That's right. When we sleep, that's whenever you recover. So your body's trained that whenever you're sick, you just need to chill out, rest, take it easy, eat well. Those are the times that you need to be doing those things, is because you're trying to stimulate that parasympathetic nervous system.
And that happens, like people experience this, right? Whenever you get the flu or you get sick, what do? You lay around for 3 days, allowing your body to get into that parasympathetic state.
Absolutely. Now, there's a couple things that you can do at home that are going to be geared towards a parasympathetic mindset and parasympathetic state. So Heather mentioned working out earlier today, and I want to kind of beat down that door to talk about certain workouts you can do that are parasympathetic based. So there are two different types of muscle groups in the body as well. There are flexors and there are extensors. So flexors will put your body, if you used every single flexor in your body, you'd be in the fetal position. So the bicep is a flexor and the tricep is an extensor. The front of your neck is a flexor. The back of your neck is an extensor. Most of your back muscles are extensors. All the abs, chest, core, everything is a flexor. Same thing, your quads are an extensor and your hamstrings are a flexor. So remember, if you're in the fetal position, that's all of the flexors. And then every extensor would put you in that anatomical state where the anatomy guy is standing on the wall, arms up like this. That is the sign for health and wellness and healing, is extensors. So whenever your body releases all this cortisol, it actually elicits a flexor response. So it'll put you into a flexor type posture, flexor type, presentation. And this is pure sympathetic dominance. So how many times have you been walking and seen someone like this, this is their normal posture? Do you think that this is someone that meditates or someone that does yoga on a regular basis or even eats healthy? Like, this is the person that's just stressed to their max and they're taking years off their life, just whatever they're doing on a daily basis, whether it be work or however they're interpreting stress. It's just not healthy.
That makes total sense, because if you think about, if you close your eyes and think of somebody that's depressed or you think of somebody that's stressed, what posture do you picture?
Exactly.
You never think of somebody that is open this.
You never think of that, dude. No way.
If somebody's stressed or anxious, they're going to be crossed and they're going to be hunched over.
They're hunched over. So you can really tell a lot about a person's life based on their presentation and posture. And that's actually the first thing I look when people come in the door is there's this thing in your body called the plumb line. So your ear, your shoulder, your elbow, your hip, your knee, and ankle should all align in one line. And the first thing that usually happens is this ear comes forward on your shoulder about 2 inches. This is the first sign of something's going on in that nervous system. You're way out of balance for sympathetic versus parasympathetic. And then so what I'll usually do is I focus on the mid back. There's this one segment in the back that these nerves go to your adrenal glands, which secrete all that cortisol. And I'll check that bone. And 99% of the time that bone is out. Especially right now, all my patients coming in right now, we're just living in stress. So to get back to what you can do at home is do extensor-based exercises to not only improve your posture, but also improve that nervous system. Your parasympathetic nervous system, I mean, that is really the key to health and wellness, is just making sure you're in that state. This is why everyone's saying, you got to meditate right now. You got to eat healthy. You got to be mindful. Don't stress. You know, this is, we got to beat that drum a lot louder. That's for sure.
Do you have a couple of examples of extensor-based exercises?
Absolutely. Superman's, if anyone knows what a Superman is, you lay face on the ground, basically prone. You lift your neck up, and then you lift your legs up. So you're basically, you guys can Google Superman exercise, and there's tons of videos on how to do that. That's all extensor-based stuff in the back. Tricep workouts, quad workouts, anything that's not chest, abs, or anything like that, which is the most common exercises. People do sit-ups, push-ups, and curls. Those are all flexors. We need to be doing the exact opposite. Tricep, extensors, and back exercises. And if you're going to couple any kind of exercises and you have to do chest, because chest is important when you work out, do a flexor and an extensor workout at the same time. So if you're doing chest, do back. If you're doing biceps, do triceps. If you're doing abs, do lower back. If you're doing quads, do hamstring exercise as well. You know, just couple those exercises together so you'll be in equilibrium, because it's very easy to get into a sympathetic dominance mode.
Awesome. We have a couple minutes left. Are you okay to take a couple of questions?
Yes, please do.
All right. Does anybody have any questions? You can just take yourself off of mute and then just pop in. Anybody? Ellen, you still with us? I can't hear you.
Okay, there I am.
Hey, Ellen.
Hi. I can't imagine why I haven't come to visit you. And I think everything you said was absolutely fascinating, especially about the adrenal connection and that spot in the back. I can almost tell you where it is, and I don't even know from having, had it pointed out to me. But that's where I hurt. And so
right between the shoulder blades, basically, a little lower.
Sorry.
Right between the shoulder blades, but a little bit lower.
That's exactly where it is. And I knew it was the spot you were talking about when you started describing it.
Pretty fascinating, isn't it?
Yeah.
So let me ask you,
Ellen, exercise help with that?
What's that?
Will the Superman exercises help with that pain?
100%. And so Superman exercises are kind of physical to get into at first. What I'd recommend first is getting on a yoga ball. And you're basically doing a reverse crunch on a yoga ball. So hands up over the head, but looking up, and you're just going to put your chest on the ball and then come right back up. And that's it. Super easy, but you're functioning those muscles in the upper back to kind of get things moving in the right direction.
I also have one of those round, long things that I got at PT where you lie on it from the base of your spine to your head and just everything goes back.
Yes, those are. Are you talking about?
It's a hard foam roller.
Nice.
Yeah.
Yeah, those are wonderful to use. Most people, what they do is they'll go up and down the spine like this, and they're chasing pops and cracks. And I can't tell you how bad that is for you.
No, I go lengthways.
Yep, I teach people to do it up and down, sideways like this, and roll out the muscles in the back. Those things are fantastic for you. There's a lot of things you can do on a yoga ball too. I can get into the neurology behind why a standing desk is better than sitting, and why most people should sit on a ball instead of a chair. I don't know if you guys have another hour or so, but I can really talk a lot about that stuff.
We'd like one, maybe another time.
Yeah, absolutely. If you're ever interested in talking about anything like that, you guys feel free to email me. My email is allgoodchiropractic.com. My last name is Allgood, like it's all good. Click on the hat here. allgoodchiropractic@gmail. You can email me directly.
His website. The couple of emails that I sent about this meeting, there's a hyperlink on his name. So you can click on his name and it'll take you directly to his website as well.
Nice. And if you know where OsteoStrong is, we're just right next door. In fact, we have a ton of patients that I couple the two together, and you want to talk about some wonderful, wonderful results is coupling those two things together. There's a lot of things that happen over on the other side of the wall for me, which is OsteoStrong, that are pretty amazing. I have patients that come in all the time and talk about their phenomenal results that they have, and everything is quantitative and evidence-based and measurable. And those are the really, really cool things to see. So thank you, Deepak, for doing all that great work next door.
Yeah, no, it's my pleasure. Like I said, I think we're aligned on like so many different things, and like we really want to change how people view healthcare. Like I really want healthcare to be healthcare and not sick care.
Not sick care, yes, absolutely. Right now, it's if you get sick or unwell, that's when you go to the doctor and you get your injection or your medicine, and then you go about your day. And that's reactive. We really need to, you'd eliminate so many things and live such a better life if you were just proactive. Just 1%. If you just did the 1%, you'd be amazed at the difference.
Yeah.
Nice. Do you guys have any other questions for me?
Yeah, I have one question for you. Now I know. Yeah, that's this is your famous latte.
We're gonna have to make a rule that if you ask a question, you gotta get on video.
You gotta be on video.
It doesn't work.
Uh-huh.
But
yes,
my question is not a question, but I want to tell you something. Oh my God, now I know. Every time I walk in, you look at me and you said, okay, I know. Okay, lay down here. This is your neck. I know what it is. Okay. And now you look at my back. And I'm just wondering, why is he cracking my back? My back is not hurting, but now I know why you do. And that's what the problem is. So I totally have to tell you that you're amazing, and how you treat everybody like a family, that is the most important thing for me. And always when you're smiling, always you're like, there's not even one time you have a sour face. What's wrong with you? That's
Well, I got to tell you, I would not trade this profession for any other profession in the world. I get to do what I love with who I love, where I love, and I get to see the patients that I love. I truly believe that this was my calling in life, and I'm truly living out my dream. I have every patient that comes in the door. I've trained my staff that patient needs to be getting better when they open the door. We need to create such an overwhelming, loving environment with a compulsion to serve that is better than a compulsion to breathe even. We need to serve every single person. And so we've done that. Even the people that come in here angry, screaming and yelling at us just because they're in pain, we still love them. And right now, this with this whole Corona thing going on, it's been the hardest thing for me not to hug every one of my patients, because it's hard for me to keep my hands off people.
Thank you so much for what you do. Totally.
Absolutely. Thank you for being such a wonderful patient.
Yeah, thank you.
So I'm going to add one more thing to this whole immune system thing. So Jimmy touched on, stress being a real contributor to reducing your immune system. And I think I've put this in every single email, but I'm going to say it again. Stop watching the news.
Stop watching the news, guys. Please stop watching the news. Man, if I had another patient that came in and told me, oh man, the numbers are up to this place in New Jersey. Guys, just please stop watching the news. It's not doing anything with cortisol. This is the most beautiful time of the year. The blue bonnets are out. We're getting so much rain in this area. I grew up here locally, and I've never seen this place this green. You have to get outside. You have to love life right now. We've been given a gift, not a curse right now. We've been blessed to be able to stay at home with our families, to love on people with the most beautiful time of the year. And you don't even get to see other people, just your family. That's such a wonderful gift. So it's all stress, no matter what, is all perspective. So if you're going through a hard time financially, or if you're having struggles with anything in life, just change your perspective. I mean, if you think you're suffering, why don't you try telling that to Anne Frank? You know, try talking to Martin Luther King about being oppressed, or you got things hard. It's all perspective. You know, they came out on top because they were able to change their perspective. So as much as it is stressful, it's really not. It's just change your perspective.
There's a 1,000, think of it this way, there's 1,000 people that would kill to be in your shoes.
Absolutely.
Regardless of who you are, there's 1,000 people around the world that would kill to be in your position right now.
100%. Even without toilet paper.
Yeah. Thank goodness for the river.
That's right. Thank goodness for the river, guys. That's what I was really doing, the kayak. Awesome, guys. Well, thank you guys so much for your time, and thanks for coming and hear me rant.
Yeah, no, this was great. I really appreciate it. You know, this would be awesome to kind of do a little more often, you know, to just try to get some more information out there, because it's more than just the immune system. And the immune system kind of branches off into so many different segues.
The
like
immune
you said,
system
you
is
spend tons of time on it, right?
Yeah, immune system is really big, and it's I mean, like, that's a 3 or 4 hour talk if you wanted to cover the full length of what the immune system is. But it really kind of boils down to communication. That's the key. Is the more communication you have in your body, the better things are going to function.
Cool. Well, if you guys want to hear the next version of this, maybe we can talk about the sympathetic and parasympathetic and get a little deeper into that. Maybe we could do that next week.
Absolutely.
Perfect.
Great.
Awesome, guys.
Thank you.
All right, everybody. Thanks everybody for joining.
Thank
Bye.
you.
We'll see y'all
See you
later.
Bye.
Bye-bye.
Bye. Thank you.
Thank you.
This was great. This was really, really good.
Thanks, Ellen.
Some meat to go with all the blah, blah, blah. You know, it was perfect.
Yeah, you know, I didn't want to make it too long.
Right.
You know,
No,
I
it
just
was
wanted to make it nice and tight. Give some actionable stuff that people can do
exactly.
at home.
And maybe I should email you. I'll email you.
Yeah, go for it. What's up?
There are a lot of other factors that go into the traditional diagnosis of osteoporosis. Because I go to a manual therapist who's into all kinds, like you, she's into all kinds of different things and I've done a lot of research.
Yeah.
And she said, well, it's not just taking this shot or working on your bones. It's the muscular system, and I'm sure the nervous, making me now think the nervous system. And maybe at some point he could talk about all those aspects too.
Yeah, absolutely.
Okay.
And you're right. It's what I tell everyone when we do a presentation for like new people that come in. It's not just as easy as taking a pill.
Right.
Right. So osteoporosis.
Yeah.
So osteoporosis is really, you know, when you're concerned about osteoporosis, you're concerned really about what at the end of the day? What are you worried about?
Breaking something.
Exactly.
Not recovering.
So, is taking a pill going to prevent you from breaking something?
No.
It's not, because it doesn't do anything for your balance.
Right.
It doesn't do anything for your strength. And it truly doesn't strengthen your bones. So that's when, you know, when we talk about, you know, the medical approach versus the physical approach, using physical exercise as medicine has so many benefits, and it's radically more effective than just taking a pill. But we are, as a society, we're just so brainwashed into,
Yes.
Well, if I'm sick, I have to get a prescription to get better.
Yeah.
But we all know that, you know, over the past 16 months, now we're getting the proof back from folks like you that say, hey, here's my pre and post bone density test. hey doc, have you ever seen anything like this before? And they haven't.
Right.
That's why they're finally sending people to us. That's what's making it so awesome.
Right. Well, I'll be back. I hope.
All right, it was great seeing you.
You too. Thank you for this. It was great. It was really, really good.
You bet. I'm going to try to do this again next week, and maybe we can dive in with Dr. Jimmy a little bit further on one of those paths.
Sure. Any and all.
Yep.
They're all good.
Cool.
All right. Thanks.
All right. Take care. Have a great weekend.
Thank you. Yeah.